In the previous video, we discussed how to manage a difficult airway and what a difficult airway might be, and then we went ahead and demonstrated how to address the difficult airway with a BLS procedure using the King tube. In this section, we're going to go over the ALS procedure, or the Advanced Life Support procedure of insert an ET tube, an endotracheal tube. Okay. So basically this gentleman here has, the scenario is that he has vomit in the airway. So he's unconscious, not responsive, not breathing. So we're going to go ahead and suction his airway out. You're going to hear some noise in a minute. Okay. So as I'm suctioning the airway, it's basically to clear out any vomit that there might be present in the airway. At times, you will notice there are bigger chunks that we cannot get with the suction yank hour, so we might just use the tubing so that we can get out some of the bigger pieces and clear out that airway real good. Okay, so once we suction out the airway, I've already checked my equipment. I have an ET tube which I've checked the bulb on. Okay, and that's working good. I'm going to go ahead and put that over here on the right. I'm going to get my blade and my handle and check that as well. My light's working, so I'm going to come in and I'm going to open the airway and check it and make sure that I can visualize the trachea and the vocal cords. And then I'm going to go ahead and pass the tube through the vocal cords. Once I visualize it going through the cords, I'm going to go ahead and stop. Okay, I'm going to inflate my bulb, always holding on to my tube. I'm going to remove my stylet, and then I'm going to bag my patient and check for lung sounds. Okay. Now, my mannequin doesn't have a chest that I can listen to lung sounds, but typically that's how we would do it. So I'll show you here. You should see my little balloons inflating. These are like my makeshift lungs. So as you can see, I'm in the airway and the patient is getting ventilated. Okay. You might notice one of the lungs inflate more than the other, and it's just because the air typically goes more into the right than the left. And in these little mini lungs, it's kind of hard to inflate the left one. And then I would just secure my tube and the airway is secured, and we'll just keep breathing for the patient.